Our webinar topic today is neglect. What are we really talking about? Educating and empowering everyone, from parents to lawmakers and health professionals, on the importance of recognizing signs of neglect and understanding the needs of families is critical. Public awareness is necessary to strengthen prevention initiatives and protect children from the harm that neglect can cause. This training will provide tools and strategies to strengthen communities and support families. Our presenters will explore the Friends Neglect Toolkit and show how it can assist your organization and community partners in understanding neglect and promising approaches and strategies to address it. Our presenters this morning are Carolyn Abdullah and Samantha Flory, both of whom are training and technical assistance coordinators for the Friends National Center for Community-Based Child Abuse Prevention, or CBCAP. At Friends, Carolyn provides technical support and training to CBCAP state leads, drawing from over 25 years of experience working on issues related to children, youth, and families. Before joining Friends, she held positions at Prevent Child Abuse North Carolina, the National Alliance of Children's Trust and Prevention Funds, and the DC Children's Trust Fund. She has worked with parent leaders to expand and advance meaningful roles for parents in family strengthening programs, including partnering with parents and practitioners to host guided community conversations where participants share their knowledge and experiences as they create strategies to improve the lives of children, families, and communities. Samantha also has more than 20 years of experience in family support and program development. She has developed and delivered specialized training and provided technical assistance to family strengthening networks and organizations across the country. And in fact, she's doing that this morning. In addition to this training, so this is her second training this morning. Before joining Friends, Samantha was the Director of Training for the National Family Support Network. Samantha was also a training specialist for 9 years with the Strategies program, now known as Strategies TA here in California. She also serves as several years as the Director of Education and Learning with the Executive Service Corps of Chicago. Carolyn and Samantha, welcome. We're excited to have you with us today.
And thank you, Dana. We're really happy to be here as well. Want to give you a little bit of background on Friends, who Carolyn and I work with, and you also can see it up in the background of our Zoom today, the Friends National Center for CBCAP. And also, if you're not familiar with the word CBCAP, it's up in the back of behind my head. CBCAP stands for Community-Based Child Abuse Prevention. So we are the National Center for that community-based child abuse prevention. We are funded by the Administration on Children, Youth, and Families, the Children's Bureau, to promote the purposes of that community-based child abuse prevention program. So basically what we do is provide that training in TA to lead agencies to really help build their capacity to prevent child abuse and neglect in their communities. And in California, the lead agency for this funding is OCAP, the Office of Child Abuse and Prevention, and we work closely with them to provide support and training, and we are fortunate enough to be able to also do these type of trainings with Caltrin as well. We've done a couple of other trainings previously with Caltrin around the protective factor survey and also around logic models. So I know you can go look for those in the archives with Caltrin. But happy to be partnering again to do training with you all today. So during our time together, we've got the next, roughly just under 2 hours together. We really hope that you will learn with us, and also from after our time together, be able to understand the definition and risk factors of neglect. We'll be sharing about that. And then we're really going to spend some time going through our Friends Neglect Toolkit, showing you the different resources there and how you can take those back to the families that you work with and the communities that you work in to use those to help support your work. And as Dana mentioned earlier, we really want this to be an interactive time together. Carolyn and I have a few videos that we're going to be showing you, but we also have some discussion questions and peer sharing opportunities. So we will be encouraging you to interact in the chat with us, and we'll pose those questions to you. And then also, you are welcome to ask us questions at any time during this. If you have a question, please put that, as Dana mentioned, in that Q&A. But we will do our best to get to all of that. You'll get our contact information if you want to follow up with us as well. So as we get started today, we thought it would be helpful just to ground our understanding and our thoughts as we move into the conversation about neglect to show a video. It's about 6 minutes long, and some of you may have seen pieces of this before, but this really helps get us in the mind frame to continue our discussion this morning around neglect. So thank you for taking those few minutes to watch that video. We just wanted to show that to kind of give a grounding in what we're going to be talking about today. So what I'd like to do is invite, if you have any reflections on that video, to share them in the chat. And one of the big things they talked about there, and you may have some reflections or comments you want to share about that, is that serve and return. Really, those responsive interactions with adults. You saw a little bit of that in the video, where the mom would interact with the baby and then she turned away, and the child was still trying to get that interaction. But that was really the big theme, was that idea of that serve and return, having that interaction that the adult is giving the child and the child's giving it back. And that's that healthy interaction. And that is often what is missing when we talk about neglect. And they talked about those 4 different categories of neglect. You know, the occasional inattention, which they said was okay sometimes, where the children are getting that serve and return most of the time, maybe once in a while they're not. But then as you look into more severe forms of neglect, that chronic understimulation, and then the one that really needs the intervention, which is that severe neglect in the family context. They were talking about when families don't have their basic needs met and children don't have food and things like that. So that was some of the foundation in this, but just curious if in the chat, if anyone had any comments they'd like to share from the video related to that. Yeah, how easy it is to cause permanent damage. Definitely. There's a lot of things that you don't think about, that just even not having that serve and return and that interaction with the child and the family, that it truly can have that lasting impact if that's happening often for the child. And that attunement is critical for their neurological health and their language development. You know, we think, oh, they might be in school and they're getting language or other things, but they really need that attunement and that relationship too, of having that serve and return. I see a comment about helping parents understand that babies need the interpersonal interaction to develop. It's so important that the interpersonal, and a lot of parents that some of you may work with have limited skills and are very stressed. So the interactions are challenging. But when you think of it, we're not just talking about necessarily having a conversation with the child. It is that back and forth with them, the playing with them, the responding to noises, maybe with your own noises. So there are a lot of different ways to have that serve and return. Um, yeah, just some more reactions of shocked. You know, you can share this with your parents. There is a link that we can certainly make sure, Caltrin, that we share the link to this video. That is something that we can definitely share with everyone, and how important resilience is, because it is easy to cause that permanent damage of when you're not having that serve and return, and the resilience of the children. And how it has an impact long-term on society and community. And it really does affect everyone. So it starts in your family. If there is neglect happening and that serve and return, and there might be severe neglect happening in the family, and it's happening there in the family context, but it does have that long-term impact as that child turns into a young adult, into an adult, is out in the community. It really can affect how they interact with others and what their life is like, and what they're doing with their life if they had that severe neglect when they were younger. And I see a really interesting comment too. Thank you, that technology use is disrupting the serve and return process, which is true. You know, if you've got people in front of their phones all day and other things, like, we don't have as much of that serve and return when you've got a screen in front of your face. Keep going. I really appreciate all our comments. Framing neglect and its converse, equal access to developmental opportunities as a social issue. It's not just an issue for individual families, and that's really backing up what we were just talking about earlier, that it really, neglect can have that long-term effect, and ultimately from within the family then impact society as well. So it's not just an issue for individual families. Yeah, another interesting comment. I hope folks are able to look through these because I'm not sure if we'll be able to get through all of them. As I think we've got another minute or two to look through your reflections, but this one's interesting. When a parent neglects their child's cry, can be for many reasons. We all know, many of you are parents, why you may neglect a child's cry, but some may feel that they don't want their kids to be spoiled brats and always be getting attention. But if they knew the damage of, really neglecting and not interacting with that child, it's important to know the effect that can have. And that the kinesthetic relationship and connection of parents with their children is fundamental, especially in those first years. Definitely. Yeah, and thank you for this comment, Cami. The sad fact is that many of the children that suffer this type of neglect are simply labeled as problem children by the time they reach school, and it's too easily forgotten that these children may have suffered chronic and severe neglect as a young child and baby, and they're really just searching. They want that serve and return and haven't received it, and that is a way that they could get that in schools, but instead, some schools just label them as a problem children. Mm-hmm. Yes, and thank you. Yeah, this video came from, and Dana said she's going to share it, but it did come from the Harvard Center. Hopefully you saw that, the Harvard Center for Developing Child, and they have a great library of resources. So wonderful. So I'll encourage you to keep looking through as people keep sharing the comments. There's some really good information up there. And just want to look at a couple of our questions too. And Carolyn, feel free to jump in if you've got comments. One of the questions is, how does the serve and return change as kids get older? And Carolyn, I'm not sure if you have thoughts or you want me to share on that.
Well, I think in the early stages of brain development, that serve and return is something that is really foundational and important as a baby's brain is developing. It's still important later on in life, I believe, but it's different as children get older, and that serve and return becomes more conversational and more interactive. But it's an important part of certainly the brain development, the architecture of the brain developing throughout childhood. Sam, I don't know if there's
Mhm.
anything else that you were going to add.
Well, yeah, we've got teenagers in the house, and they are very good at saying like, "Oh, you've just been looking at your phone," or "You didn't hear me because you're looking at your phone." And I think even as they're getting older, and one of them's college age, they still want that interaction. They crave that interaction. And it's so important. It does change, obviously, the way you interact with someone that's much younger than with a teenager, but still to have whatever that interaction is. If it's a conversation, if it's just sitting down with them, having a meal, playing soccer, whatever, they may be interested in, but finding the ways to continue that connection even as the children get older. And it does change over time how you interact with somebody based on their age. There's a really interesting question too, and this one is, if the mom is deaf or hard of hearing, she's not really able to notice her child's emotional need, if there are any resources for her to learn what her 5-year-old needs. So this is an interesting kind of development question, but also a way to explore other ways of that serve and return when there isn't verbal communication or listening communication. A lot of times that comes down more to things like eye contact and physical communication. But I'm curious if there's anyone in the chat, if you have any resources, if you've been working with families that are hard of hearing, have parents that are hard of hearing or deaf, and if you've got some resources that have been helpful for them with the parent-child interaction, if you would be willing to share those in the chat. And Carolyn, I'm not sure if you've got some ideas for that.
I don't actually, off the top, have any resources that I'm aware of. So that's something that we can explore, and hopefully folks out there in the audience might be able to share some of their tools and resources that they're aware of.
One last question as we go through here is, which of the 4 categories can be substantiated by child welfare as neglect? And that's really looking at the 2 that say severe neglect, like the number 3 which was severe neglect in a family context, and that's where the basic needs aren't being met. They are not being fed properly. They may not be housed or kept safe properly. And then, of course, the severe neglect in institutional settings as well. I'm not sure how many of you work with that, but the 3 and 4 are definitely the ones that fall under that severe neglect category in that family context. Now, number 2, when you look at chronic understimulation, if you're working with families, that's something to be observing and watching and giving resources to parents to help them engage better with their children.
And Samantha, isn't that also something that is reflected differently depending on state legislation?
It definitely is, Carolyn. And we're going to go into that in just a second. I know you're going to talk about that, but and I know this is technically a California webinar, but I know we have people from a lot of different states. And as we move into kind of giving some examples, we're going to talk about one state here, but I encourage you to get to know your state's legislation around neglect. Some states are actually changing their legislation around neglect and poverty and what that looks like. And it's important for you to know, based on what state you're in, what the legislation says and really what that means. So with that, I'm actually going to have Carolyn talk about a state that we're working with. And so she's going to give us some context and then some examples.
Thank you, Sam. One of the things that we heard in the video and that was mentioned is that neglect is the highest cause of reports in terms of child welfare. And oftentimes that report or attention to that particular family is a result of not necessarily neglect as we've been talking about it, but maybe more connected to the inability of the family to provide some of the basic needs. So the World Health Organization, you see on your screen, says that neglect refers to the failure of a parent to provide for the development of the child, but also for some of the basic conditions that help children to thrive. So health, educational, emotional development, nutrition, shelter, safe living conditions are all categories that kind of fall under the neglect heading. And they have stated that neglect occurs in cases where adequate care is not provided when resources are available to the family or the caregiver. So that's an important distinction. When we talk about poverty, it's much more complex. It is defined as a pattern of not being able to provide and chronic lack of resources for children within a family. And there are a lot of states that are now taking a careful look at making sure that there's a differentiation between neglect and poverty, and really, in some cases, changing their legislation to amend the definition of an abused or neglected child to specify that parents or caregivers' inability to provide for their child due to a lack of finances is not neglect. One state in particular that we've been kind of working with and following on this topic is Kentucky. And they have, well, first of all, they're ranked number 5 with the highest rate of poverty in the country. So they have in Kentucky 17.3% of the population living below the poverty line. They have made a concerted effort to really make the difference in terms of how poverty is not neglect. And they have changed their legislation as a result of their research and their study and their looking at evidence-based resources and strategies that can support and strengthen families when poverty is the issue that is causing families to get reported for neglect. So just recently, Kentucky has had a big change in terms of getting this legislation amended to change the definition of child abuse and neglect to reflect that lack of finances is not neglect. They've also changed the way their CBCAP state agency is housed, and they have a new division, which is the Prevention and Community Wellbeing Division. And so they're very focused on primary prevention, strengthening families, programming that will support families before they get into a situation where they might get reported and referred to CPS. They've broadened their focus on parent engagement and partnership so that parent leaders are very much engaged in terms of advising and providing feedback in terms of the programs and services that are happening in Kentucky. They've had a pretty big change and focus in terms of their systems. They are a part of an effort that Friends has done over the last couple of years called the Prevention Mindset Institute. They are one of our partners in that initiative, where states have become engaged in conversation with other states and experts in the field on how you really move the needle in bigger systems to make changes, mindset changes, and how we look at legislation, policies, programming, resources, how those resources are made available to communities. And what they have found is that the engagement of families in terms of partnering with systems and really giving a real life perspective on how programs, policies, and all of these strategies are actually impacting children and their parents is making a difference, and it's shifting the way that they go about doing their work.
Carolyn, before we get into our discussion question, I want to share a couple of things that are coming through the chat and some resources. And I appreciate Cynthia's been sharing about California. And she mentioned that the CDSS has changed the definition of neglect, that poverty is not neglect in California. And they did just change their statutes to specify, as Cynthia is saying, that general neglect does not include a parent's economic disadvantage. So that's new in the statutes in California, and good to know for those of you that are in California. And Dana just dropped that. If you want to read about that, it's in the chat. And also, as we move into our discussion question, and this was also mentioned, thank you, Cynthia, that California has a state task force that's currently addressing this issue. And they have this task force that's looking at moving from mandated reporters to community supporters. So that whole idea of what Carolyn's talking about instead of reporting everybody, really supporting them and getting the families the supports that they need. And it's really great what's happening in California with that task force. I've been following along with it, and I think it can be something that can be a model for other states as well. And I know that this will be a conversation, and there will be more information coming out about this task force in California. So what you have that just got dropped in the chat about the task force, I believe it's probably the strategic priorities that are part of this ongoing task force. And the task force is called Mandated Reporting to Community Supporting Task Force, Communities Keeping Children Safe and Families Together. So It's really great work that's happening in California. And I'm going to take a minute before we get into our discussion.
I saw that Lupita had a raised hand. I don't know if she put a question in the chat
Yeah, I don't see it. I don't see
or
it in
the
the
Q&A.
question and answer. Maybe oh, it was an accident. No worries, Lupita. Let's
Okay.
have our discussion question, and then I'll get through our other questions. And if you have a question, if you would please put it in the Q&A bubbles, we'll get to it. I see your hands raised, but if you would drop it into the Q&A bubble, we'll get to that. But Carolyn, first I'm going to have you set us up for this discussion question if people want to share.
Sure. So as I mentioned, the Friends, has put together a Prevention Mindset Institute where how many states have gone through that, Sam? A total of
Probably
10?
about a dozen, I think 11 or 12.
Yeah.
Yeah.
States have been a part of that, really bringing a lot of insight from what's going on in their states, how they've seen the systems change, collaborate, partner, particularly those efforts that are more focused on the primary and secondary end of prevention with tertiary prevention to really look at how they can partner and come together to make shifts, big shifts that will make a difference in policies that will ultimately have an impact on communities. And one of the questions that was posed in one of our newsletters for the Prevention Mindset Institute had to do with this whole notion of how do you create a um, a movement that shifts the narrative from reporting families to supporting families who are lacking basic needs, and how do you work towards advocating for families that have felt like they've been stigmatized. So just wanted to kind of put that out there to see what you all are thinking and what you all may be seeing in your communities about how that shift is occurring and how you may be seeing, hopefully, a change in terms of that narrative of um, supporting rather than reporting all the time.
Yeah, and as you're thinking, and please share in the chat because everybody can see it. I'll share a couple of things that have come through here. Starting with California, and I know many of you are from California, but the California counties have their comprehensive prevention plans with a focus on strengthening community prevention services. And just an idea and a suggestion from one of our participants that maybe the neglect report should go to a hotline that can get organizations to respond with help for the family, someone to access the situation to best help. So it would be a specific place they could call. Also mention of the Family First Prevention Services Act. Many of you may be working with that or under that. We've got a resource from Minnesota about their parent support outreach program. That's for this purpose of the discussion question that we're talking about. It's incredibly successful, wonderful in preventing reentry in the child protection system. And we've got a link for that here too. So that's great. That's from Minnesota. And then, yeah, this kind of discussion is a good opportunity for basic income stipend for families, of course, to help them meet their basic needs. Also a comment about continuing to work towards better and different training for mandated reporters. And I think that's ultimately what will happen in California and hopefully in other states, that instead of having a mandated reporter training, there's going to be training that's more towards that supporting and a different way of doing that training for people that are working with families. And yes, family resource centers are definitely a great way to support families with resources. And how do we get this information that we're talking about here to those family resource centers so that they can really help with this supporting families and what that looks like? So I see another great resource here, Jody. Thank you. Around the hearing loss, and it's called Success for Kids with Hearing Loss. So great resource. Thank you. Also, some suggestions for parent referrals about providing and referring parents for different parenting classes or rehabilitation. And just the idea of advocating. I think this California task force is coming about because people really advocated for it and said, we need to do different. You know, we need to really look at what we're doing around mandated reporting. And so advocating for a different way for families, for differential response and different ways of working with families. And education, of course, advocacy, education for the systems that are to support families on bias. And so that education could be on bias, trauma responsive care. That'd be really helpful, looking at that trauma care. And that bias is a big reason for stigmatizing families. So looking at also things around that. So these are all things coming from the chat. Looks like Utah, I know we've got Utah on here, is having these discussions as well. And just a comment about one of the counties, their CPS has differential response when a call has been made, but there's not enough evidence or substantiation to remove the child. It's a way to connect families to their neighborhood resource centers for services to provide support and education. And I know I also provide technical assistance to the state of Montana, and they're working on something similar to, they call it community response, where they are looking at how they can really help families that may have risk factors for abuse, how they can help those families get the support that they need to keep them safe, whether it is housing or food or transportation, education, whatever that might be. They're looking into that.
You know, community response is also one of the strategies that they're using in Kentucky in response to the systemic changes that they're making there. They also are connecting with family resource centers, but they're also reaching out to churches, and they have pretty big connection with schools. And so they have schools that are working together with them to, I guess, inquire about some things that may be going on with the family before it gets to the point that a call is made or a report is made. And they have made such great strides with that, because a lot of the things that they see going on are incidents that are happening that just occur in families, that if somebody knew about it, they could connect them with a resource and provide them with some support, and that problem could be eliminated. So community response is really taking off across the country and really getting good results as a result.
That's wonderful. Just a couple more things, and then I want to get to our questions too, because I know we have some questions in the Q&A. But one of the things I want to share in here is related to the idea of stipends, and this comment that in their county they have a program called Families First, providing stipends to caregivers of young children who participate in education on topics such as trauma responsive care, social emotional development of young children, and self-care. So that idea of providing some stipends to help support the families while they are getting educated. And then also having schools engaging more with the family to offer resources instead of just always making a report, knowing how they can offer some resources to that. And going back to, family resource centers we heard earlier, I know that there are some family resource centers that are either school-based or connected to a school, and that's a great way that the family resource center can help support the school in getting resources to the families instead of just making those reports. So let's go, I'm going to go into our questions for a minute. And the first one, what about parents that use screen time more than FaceTime, than the face-to-face time or floor time? Can that lead to neglect? And I don't want to, we don't know yet what that looks like, and it totally depends on the family and what's happening. So, I don't think that's something that we can absolutely say, oh, if you have more screen time than face-to-face time, it's going to lead to neglect. But if you're working with the family and you notice that there isn't that engagement between the parents and the children, and the parents may always be on their phones or something, it is when you want to talk to them about that serve and return and what that could look like, and helping them. They may not be confident or sure of how to interact with their children, and so helping them with those skills to do that. Does this poverty neglect distinction make it more difficult to assess the type of intervention needed? And Carolyn, I'm going to ask you know, if you know anything of that from Kentucky or what you think. So does the poverty neglect distinction make it more difficult to assess the type of intervention that's needed? And you're on mute still.
Sorry about that. Sometimes, based on what I've heard that's going on in Kentucky and some other states, it sometimes makes it easier because once the situation has been assessed, then it's easier to know what the family needs, and a lot of times what they need is something that can be provided by a family resource center or some other kind of community support. Um, Once somebody has kind of gone through the process of determining what the actual situation is, it makes it a lot easier to connect folks to resources rather than automatically um, sending that report in. I don't know if that's the case everywhere, but it seems to be that differential response kind of a deal where once it's been looked at, it can be set in a different direction, and then there are resources that are available and ready to help.
Thank you. Now, this next question, I'm going to be completely honest. I don't feel like I necessarily have the knowledge or education on this topic to really answer. But if anybody else has thoughts, please put them in the chat. And it is, I've been hearing a lot about child identity theft by parents and the push to identify child identity theft as child abuse. Do you see that as something that could be added under neglect or recognized in a different way? And Carolyn, I haven't heard much about this. Have you?
No, I don't know anything
So
about.
yeah, if any of our participants, you know, have done any work or seen anything related to child identity theft and if it could be added under neglect, we'd love to hear your thoughts on that, because that's just not something that we've had a lot of discussion about. Um, and I think our next question is getting answered in the chat about California's ranking for poverty. I see percentages flying by as I'm looking at this. And here's just another suggestion over here. You know, people often report neglect because they don't know what else to do, which is true. That's why we're having this discussion today and hoping to give you resources. Maybe if communities could provide resource lists that are easily accessible in schools and other places, definitely could help with that to really educate and make sure people have resources.
And there are a lot of states that are doing warm lines. That's also
Mhm.
an option for folks to call and be able to be referred to a resource when they don't know where else to go.
Mhm. So we did have a request for the 4 categories of neglect. I'll get those in the chat for you a little bit later. I'll type them into the chat, so we'll get those for you. And yeah, and a great point, Rebecca, that it's definitely possible that many of these families that are in poverty don't have transportation to reach the resources they may need. And that's where, you know, all of us working in the prevention field need to hopefully can get creative with that, go to the schools, go to places where families are to help get them their resources. And that is a struggle. And we work with a lot of rural areas as well. And it is very hard because you can't always reach these families. They don't have transportation, internet, different things like that. And so it's an ongoing conversation, I'll say, to figure out how to reach those families where they are if they can't get to the resources that they need. And, you know, unfortunately, it's an ongoing conversation, but for us to be aware of even what's in your community, you know, I live in a big city. I live in Chicago, but there are neighborhoods in the city and you think, oh, in the city, no problem, people can get places. But we have these neighborhoods that are food deserts and other things there where they don't have access to these resources. There's not a community center, there's not a family resource center. Public transit doesn't really work well there, you know, and so even in the big cities, things like that happen as well. And so it's, first of all, identifying those areas that might need the help. It's identifying where that transportation may be an issue and then trying to figure out how to address that. And it's a big task, but it's important to be talking about. All right. I think we got to everything in the questions, and I just want to make sure you all are reading through the chat. There's so much happening and there's such good information. Keep it coming. And make sure that you are reading up on what you see in the chat as Carolyn and I move on. This is great discussion. And we want to make sure that we're also giving time to show you some resources. And the information will be available in the chat until the end of this webinar. So you have another hour and 7 minutes to read through the chat. So take your time and pop through there and definitely click on some of the links that people are sharing. And we're actually now going to get into helping you all with some tools and resources that we have available with Friends, which is our Neglect Toolkit. And you have the link for it down there, but I'm actually going to show you our website so you know how to find it. And you can access this at any time. So you're going to click on the link that Haley gave you. You might even want to bookmark that. And then I'll take you to our website and show you what this looks like and how you can pop around there to learn more about this neglect toolkit. And I am going to go into each of the parts of the toolkit after I show you how to find this. So just want to give you a high level overview. You have the link in the chat. You can also just Google our Friends website. It's friendsnrc.org. When you go to the Friends website, by the way, we have so many great resources. Highly recommend you checking it out. But for today, we're talking about the neglect toolkit. That's found here under resources. All the way down here, you just kind of scroll down to neglect toolkit. You click on that. This is our page with what Carolyn and I are going to be going into in a moment with all of the resources that we have for you. And so what you'll do is you'll scroll down, and she and I are going to go into each of these 5 sections and explain to you the resources we have and talk more about it. But when you come up here on your own, what you do to get into each of these sections is click on the little plus sign and it'll give you a drop down. Now, also when you're in here, and I'm going to go into this defining neglect section a little bit more, but what I really want to show you is that once you're in understanding neglect, there are also different categories in here along the purple. So you can click on defining neglect to get more information on it. You can click on risk factors, chronic neglect. So you really can do a deep dive into this website. There's links that are hyperlinked in here. There's a center on the developing child at Harvard, which we heard people talking about in the chat. They've got wonderful resources. So you have a lot of ways to explore here in the toolkit. It's a nice virtual toolkit for you to go explore. We're going to go into each of these sections now to give you some more information on them. But just wanted to make sure you saw what the website looked like. So we're going to go back to our PowerPoint and talk a little bit more about understanding neglect and what we have there. And just checking the chat, you've got the neglect toolkit. You'll get the resource links in your follow-up. Got some information about the poverty line in the US. So there you go. Great resources. And as we get into talking about the first drop down that's on that webpage, when you click on understanding neglect, we're going to talk about what neglect can be characterized as. And it's characterized as occurring in different but often overlapping domains. So you see here, and this is really just sort of more of that foundational stuff for you. These domains can include physical, which is failure to provide necessary food or shelter, or lack of appropriate supervision. And again, this is, when you have those resources available and you fail to provide that for the family. Medical failure to provide necessary medical or mental health treatment that's needed. Educational failure to educate a child or to attend to their special education needs. And emotional, inattention to a child's emotional needs. You think about, we were talking about that serve and return, the failure to provide psychological care or permitting the child to use alcohol or other drugs. These are all things that are under that understanding neglect that can be characterized. Sometimes there's more than one of these that's happening. And again, it's important, the discussion we were just having about neglect versus poverty, When we think of the physical neglect about providing necessary food or shelter, it really is more about when you have the means to do so and you still are not doing that. We know there's parents out there in poverty that are striving every day to get food or shelter for their families. But the true physical neglect is when they have those means and they're not providing it and they're not doing it. And what does that look like in the families and in the communities that you're working with? So this really gives you that foundation on it, and just kind of the understanding of it. And I think in the next slide, we want to talk a little bit more about the factors that increase the risk for child neglect. And now poverty is here, but again, like we've been talking about, poverty does not mean neglect. It can be a risk factor for it, but it doesn't always equate to it. Low socioeconomic status or insufficient resources, substance use disorders, mental health disorders in the family, domestic violence, intimate partner violence, if there's parents' history of trauma and or abuse. And we heard a lot of folks talking in the chat earlier about, understanding trauma responsive services and trauma informed care, which is very important to help understand a parent and to help prevent neglect from happening, and also social isolation. And I do, we've been emphasizing it, but I want to emphasize it again, that while being poor does not by itself predict neglect, research has shown that certain types of socioeconomic disadvantage are associated with neglect. So again, it's really helping families find the resources, but once they have them, also making sure that that family's safe. And I would just want to note that most people in poverty do not maltreat their children. We're not saying that at all. But it's just finding out what's happening with the family, assessing their resources, getting them the supports that they need so that the children are safe. So we want to share with you, and we're going to go back to our Friends website to take a look at this. With Friends, we have a National Parent Advisory Council, and we have parents from all over the country that are part of the council, and they share their stories of their parent journeys with us, and we've recorded them, and they're up on our Friends website. So I will show you where to find these, and then we're actually going to show you a video from one of our parents. So you may be on the Friends website poking around here in Neglect Toolkit. And then the sharing the journeys, voices from the field, is also in the resources section just over to the right. So we're going to share with you Beth's story from the parent leadership. And I am going to make sure real quick that I've got the sound working this time around for you all so that you can hear our sound, and I do. Just a quick couple of minutes of a story from one of our parent leaders.
Sharing the Journey, Voices of Parent Leaders is a resource of the Friends National Center for Community-Based Child Abuse Prevention. Sharing the Journey was created by the Friends National Center Parent Advisory Council to share their perspectives and expertise on the journey of parent leadership and impact that prevention services, practitioners, and families have together. The story you're about to hear represents an authentic parent experience and is told in the words and the voice of a Friends National Center Parent Advisory Council member.
I'm Beth Stodgel, and this is my parent leadership journey. Just recently, the parent leadership coordinator at my state agency asked me to join her at a CBCAP conference in a neighboring state. We were asked to present information about the benefits of starting a parent leadership program, and we were thrilled to be able to share our thoughts at 2 overcapacity sessions. Preparing for this opportunity compelled me to reflect on my own parent leadership journey. Just after our first child was born, my husband and I made the decision that I would forego a career to stay at home and raise our children. It would be tough financially, but we were determined to make it work. We didn't realize how tough it would be for me emotionally. Living in a university town, surrounded by dual career families and PhDs, the required attendance at faculty functions left me feeling that people believed I was either too lazy or too stupid, or possibly both, to have a career. I too began to question my abilities. My husband did his best to encourage me, but with each passing year, my belief in myself diminished. Eventually, my self-esteem was shattered. Enter Miss Winters. My son entered first grade, and something magical happened. At parent orientation, there was a sign-up list for the class. I didn't know if I could be helpful, but I signed up anyway. Mrs. Winters quickly put me to use. At first, I just cut construction paper and made copies, but quickly my role evolved and my responsibilities grew. My involvement in my children's education grew with each receptive teacher. My responsibilities increased, and even administration began asking for my involvement. And, slowly, my self-esteem returned. My children entered high school, and the request for parent participation diminished. Needing to feel useful, I looked for volunteer opportunities that matched my skill set and my passion. My love for children led me to CASA. The training was thorough and intense. The work was gut-wrenching. But the children and the outcomes made it all worthwhile. As a court-appointed special advocate, I quickly realized the best way to advocate for these children was to advocate for resources for their parents. That lifting up families was the best way to ensure these children had safe, nurturing homes. I watched these parents grow, watched their self-esteem blossom. They became role models for their children, resources for other parents, and wanted to share their stories and their successes with others. I began to reflect on my own childhood. What if some of these resources had been available for my mother, for our family? Would I still have an ACE score of 7? Would I still be doing this work? What if Mrs. Winters had never encouraged me to be a parent leader? Would my despair have led to depression and addiction? How would that have impacted my children, my family? Now I work at the local, state, and national levels to foster the leadership abilities of other parents and to encourage other organizations to implement their own parent leadership programs. I truly believe that ending child abuse begins there, and what a better place to start.
The Friends National Center for
I think it's always helpful to hear from one of our parent leaders like Beth about how social supports and having those resources available can really make a difference for the families. And so you can find that story up on our website, along with all of our other parent stories, and we'll share another one with you a little bit later. But it's nice to hear how that can be helpful, and interesting how she also reflected back to her upbringing and how having those resources available could have made a difference when she was being brought up. So we're going to move into our second tab under the Neglect Toolkit. But right before we do that, I think I just want to check real quick on our questions. Okay, Kristen, we're going to come back to you. So we're going to leave that question in there and we will have that discussion. So, but now we're going to move into our second drop down around preventing neglect. And this image that you see here is really hard to read. So I think Haley's going to drop a link to find it on the Children's Trust Fund Alliance page. Now we worked, when we created this neglect toolkit, the Alliance partnered with us and gave us this information to put under that second tab around preventing neglect. They still use this graphic today and have shared it with us as a part of the toolkit. But I just want to highlight a couple things for you. And this is around understanding neglect within an ecological system and the role of the protective factors. I would imagine many of you are familiar with the protective factors. If you don't happen to be yet, Caltrin has some great trainings on the protective factors. So look through their training archive for that. But the way that this comes down, and if you can't see it well on the slide, you can look at the webpage while I just briefly go over some high level of this. You see that you have the ecological system with society, community, family, and then child. And on the left-hand side, they talk about the different protective factors related to each of these different bubbles. So they talk about concrete supports related to society, and they offer some concrete supports there, such as family policies that provide supports that families need, some other adequate resources. And then they move into social connections. And they do have a couple of concrete support protective factors for community, but then they go into social connections around community as well. And then down into family, they go into the protective factors around knowledge of parenting and child development and parental resilience. And then down to child on the bottom, they've got the social and emotional competence. So it really is an interesting way to lay out the protective factors along with this system. And then on the right-hand side, they list the various risk factors related to society, community, family, and child. And just a couple of the high-level things with society, they were talking about poverty and deprivation of basic needs. When you go into community, they talk about impoverished neighborhoods, environmental problems. Into family, they talk about material hardship and economic insufficiency or situational or enduring problems. And then for the child, they talk about child vulnerability. So you can look at both the risk factors on one side and the protective factors to put into place to help mitigate those risk factors are listed on the other side. So this is a really interesting graphic. And in the preventing neglect dropdown in our neglect toolkit, when you are online, there are a lot of different resources. It'll take you to the Children's Trust Fund Alliance, as well as some other resources. But I want to give Carolyn some time to talk a little bit more about protective factors under this preventing neglect section. You got to unmute yourself again, Carolyn.
I'm sorry, I thought I had done that. So as Samantha mentioned, we all know that this work is really grounded in the protective factors, and that's the same for protective factors when we're talking about neglect. I just want to start at the top and have a look at the purple triangle that focuses on social connections. And we know that in terms of supporting families and parents all along the way, those social connections are critical. Positive social connections are really valuable. And I think about my own experience as a young mother and how important it was for me to have the support and the knowledge and wisdom of people that had more experience in parenting than I did, that could offer me that emotional support as well as solid information, guidance, and affirmation for what I was doing as a parent. That's critical, as is, as we all know, concrete supports in times of needs. That's one of those protective factors that all families need and can relate to. Having the access to resources to address your family's needs. Sometimes when you have those resources available to you, then the chances of neglect are diminished because you actually have what you need to support your children and your family. Going down to parental resilience, parenting is very stressful. We know that. But being able to manage stress and sometimes trauma is one of those underlying factors that can make a difference when you're faced with challenges. And so we know that providing the strategies, programs, services, supports that can reduce stress and support and raise resilience and a family's ability to be able to bounce back from something before it becomes more dramatic and traumatic is really important when we're talking about preventing neglect. Nurturing and attachment, being able to create and connect a bond with children through positive interactions. Sometimes that's easier for some parents than it is for others, but having the tools, the knowledge, the understanding of the importance of those emotional ties as your child is developing and as you're developing as a parent is really an important factor in keeping families strong and preventing neglect. Children's social and emotional competence, being able to support children as they develop in terms of their communication skills, their ability to regulate emotions and establish relationships. I have had to draw on my toolbox again as a grandparent with some of these things, and remembering how important it is to be able to support children as they are learning how to communicate and they're learning how to self-regulate. And this kind of, all of these connect because supporting my grandchildren and supporting my children who are new parents and raising children is part of those social connections and the nurturing attachment and the support of parental resilience. They are all connected and all equally important. And of course, the knowledge of parenting and child development. Over the course of my career, I have interacted with parents. Sometimes they're young parents who don't understand the different phases of child development, and therefore their response to their children's behavior is a little out of sorts because they don't know and they don't understand child development. So being able to provide support and parenting education and parenting support is really important, an important factor in preventing neglect. Sometimes parents don't know at what age a child is supposed to do a different thing, or at what age a child is able to be left alone. All of those have a connection to preventing neglect, making sure that parents have the skills and the education and the understanding that they need to be successful in their parenting journey. So these protective factors are, again, important for all families, as equally important in child abuse as it is in preventing neglect. On the screen here, you'll see some strategies that we know are connected to various protective factors, programs that focus and emphasize the skills and the resources that are important for providing concrete support, those programs that provide, diaper banks or clothing banks or food banks, personal hygiene resources, gas cards. All of those are concrete supports and strategies that are in place in communities to support that, improving housing opportunities and household financial security are very important protective factors and strategies that resource centers and schools and churches are providing to support families that ultimately help in preventing neglect. The protective factors of parental resilience and nurturing and attachment and knowledge of parenting and child development and social and emotional competence can be undergirded by having programs that support parenting skills and parent support, peer support, early childhood, home visitation, those programs that really seek and support the parent voice and then provide capacity for parents to build their parenting skills and to support their families. Public education and engagement programs that provide knowledge and information in ways that reach out to all families, not a particular kind of family, because we know that all families need support and need resources, and all of that support and resource can help to prevent neglect. Knowledge of parenting and child development and social connections, social and emotional competence of children, those are protective factors that are provided through quality childcare, early care programs, those programs like Head Start that in addition to providing quality childcare also involve and engage families and provide them with support and educational information to make their journey better and to help them be more prepared on their parenting journey. And then, of course, legislative approaches and policies that support and fund the programs that we need in communities and the programs that we know make a difference for families. So the protective factors are connected in so many ways to the success of families that ultimately prevent child abuse and neglect. Friends has a resource that is available on our website that provides a crosswalk of evidence-based programs that are designed for our CBCAP leads, but they are available to anyone that can access our website. And it's a way to kind of look at the 6 recognized registries for evidence-based and evidence-informed programs and practices, and kind of line up the programs, the registry's rating, and the impact that they could have for the families that you're working with. So that's a tool that's also available on the Friends website. There's a link there. And I think that information is also going to be available as a handout or tool. So we're going to pause again and take a moment to do some peer sharing and talk a little bit about what programs do you have in your community that support families and address concrete support needs? And do you have any programs connected to concrete support needs that specifically address physical health, dental health, mental health? I know there was a question earlier that came up just in terms of transportation as being an issue in many communities. Just wondering if there are any mobile kinds of resources that may be available in some of those harder to reach communities that provide a range of services that are supporting families. Your thoughts?
Carolyn, as people are putting their thoughts in the chat, and please do, I know it's so helpful for everybody to see what people are sharing. I want to get to our question that's been kindly waiting for us in the Q&A, and it is, how do you balance between encouraging people, mandated reporters, those who are mandated reporters, to provide support to families who may be experiencing poverty but not neglect, but also not using the message education to discourage people from contacting the abuse hotline if they do suspect abuse or neglect? And I think some of this will go to what the task force is trying to work on. You know, some clarity around this to help in the state of California and some other states that are starting to look at this, like figuring out what this is, and even giving some tips and some help to people, like, you know, this is how you support the family and this is what you can do. But these are some places where you want to think about, you still do want to call the hotline or make a report if you really, this is still what abuse and neglect look like. So it's an education piece of really understanding that. And it is kind of a fine line, as you can tell in our conversation today, of figuring out, you know, where it is that some resources might just help that family versus, no, this is really something that needs more intervention or help with it. So I think that's what the task force is really trying to look at in California and figure out. And Carolyn, I'm not sure if you have any other ideas on that, and how you're encouraging folks to be those mandated supporters, but also when they still really do need to make a report, what that could look like.
I'm anxious to hear what's going on in communities. I think we're all at a point where we're learning a lot of the programs that are kind of diverting calls in another direction. differential responses and community responses, are still working out their processes. And so I'm anxious to hear if anybody on the call has any examples of how that's working.
And as you're maybe sharing some examples or thinking about that, I just want to share some other things that are in the chat, talking about, programs that address concrete support needs. And thank you to Indiana for weighing in. They have a child protective service standard that they call family prevention that helps with concrete needs. And then they also have a local family resource center as well. Indiana is growing their family resource centers, which is great. But they can turn to their local family resource center for some needs. This one's really interesting. This agency has free chiropractic services and acupuncture services once a month, and then some free alternative wellness services. So I think that's a wonderful idea. Some other things that I know some folks who have some chronic pain and chiropractic things, and it affects your overall mood. And if you're a parent with younger children and you are in pain with things in your body, like it can affect your parenting as well. So having those free chiropractic and acupuncture services, I would imagine it can really help some families. Another comment about having community hubs that are made of early learning specialists and community health advocates from public health. And they have monthly food and diaper giveaways in different locations in their community each month. There's no documentation or ID required. So that's another idea of kind of what Carolyn was talking about with like mobile services. So these community hubs move around to different locations every month with their food and their diaper giveaways. So that's great. And Santa Cruz County is weighing in. They utilize their flexible funds to provide concrete supports such as help with rent and utility bills, clothing, furniture storage, psychological evaluations, transportation. Wonderful. So using those flex funds from your county. We've got LA County weighing in too, that they have FRCs that connect families to concrete supports and collaborate with a mobile health clinic, that idea of mobile services to address some of the needs that we've all mentioned. And a little bit more from Minnesota too. I love my Midwest representation. They have a program that provides grant funding to each county for concrete supports. And their intake line directs child prevention calls to this program that provides those concrete supports. So that's great that you have, this is a really good example of a link with their intake line that people are calling as mandated reporters and making a link to community services to help with some concrete support. So Minnesota, I love that PSOP program that's got the link with the intake line and that connection with them. Hoping to expand concrete supports to families exiting the child welfare system where risks may be low, but families are still in need. Yes, helping those families with their concrete supports. Oh, this is a really good suggestion too. Around the earned income tax credit that many parents may be unaware of, and it helps families with low income to raise their income based on what they've earned during the year. It's a federal program, and there are some states that have additional state-based programs for earned income tax credits. And the money comes to the families in the form of a refund, but the parents do have to file their income tax to qualify. So it's one important reason why helping low-income families with tax preparation is important. And I know I've heard of some family resource centers and different community centers that help with that. Sometimes they bring in some tax prep help that is willing to do that with the families for free. But great suggestion, and to look into that earned income tax credit and helping families access that. So I appreciate that. Parent cafes and resources is great. Got some more from Indiana. They have a Goodwill type place. Everything is free. It's called Caring Clothing Co-op. It's donated items. It's staffed by volunteers. And then they also do backpacks for back to school. FRCs, helping parents with housing and Medi-Cal. Family Resource Centers can help with so much. They have a partnership with Children's Health Agency to provide dental health information. And we do have a request, if you are sharing, if you wouldn't mind sharing your state or your county, that's helpful too. We like to call out if it's Minnesota, California, wherever. And then Santa Clara County has clothing donations from families they can choose from and connections to their thrift stores with vouchers so they can get some items. And Utah, thank you, Utah. They've got crisis nurseries attached to some of their family resource centers, and a parent can bring their child there if they're in need of going to an appointment or needing some time for themselves. And that's one thing we haven't talked too much about, Carolyn, that idea of those crisis nurseries that some states have. Carolyn and I have visited some to give resources and support for parents. And then one last one, working with local FRCs, providing free income tax services and food bank services. This is from Nevada County, and using Flex Fund for diapers and gift cards and other things. So thank you all for sharing. These are great resources related to this discussion. Just one more that coming from Lake County in Middletown, that their tribe, Middletown Rancheria, has started family strengthening events that are sober events. They didn't really know what they were doing, but they did it to get the kids off the reservation and get the families together, other than those tribal meetings and politics that they may have had. And now it's grown into a parent committee, keeping families involved, peer support and inclusion. A wonderful example with their tribes and the work that they're doing there. So thank you for that. All right, Carolyn, I think we've got through most of it, and encourage everybody to keep looking in the chat at what people are sharing.
Thank you. One of the tabs that Samantha showed you in the beginning, that's part of the toolkit, focuses on policies, public systems, and partnerships. And you know, the focus here is really to look at ways to leverage and partner with a variety of public systems and to form partnerships that ultimately can support policies that will make a difference for families. And so just really looking at those places that could make things easier and more efficient for families by potentially partnering, sharing resources, sharing or blending funding, and program strategies that will make a difference. So, you know, looking at, for example, physical health and behavioral health, early childhood education, and the larger school system, economic programs that can partner to support poverty reduction, the housing and homelessness, connecting with economic and poverty reduction programs, taking a look at where workforce development is in your community and how that could be leveraged to support programming and resources for families that may be trying to find employment or need some training. Financial literacy programs. We actually have a course available on our online resource center on the Friends site that offers some courses, and I'm sure that once you take a tour of our website, you'll see that there's lots of online courses, and there's a financial literacy one that's available on there. Domestic violence programs, partnering with behavioral health or other health programs to support families, looking at two-generational approaches where we're not only supporting the children, but we're providing support to the families, and that could also extend to extended family members, parents, grandparents, aunties, uncles, whoever happens to be in that family unit. And of course, we've talked a lot about alternative or community response programs. Those have become more popular and more available in a lot of states over time, but it took some time because there have to be policies and strategies put in place for those kinds of programs to be available and then for them to work smoothly and to have the resources that are necessary when you're going towards a community response, making sure that the community has the resources and the supports that are needed in order to make those programs work. The next tab that Samantha had mentioned was public awareness and engagement, and the community toolbox. And I hope that many of you are already familiar with that. It's a wonderful resource. There's the link there, but it has a wealth of information. And one of the favorite places that I like to go is they have, I think, 6 toolkits that are available for you to download that really provides step-by-step support and direction in things like creating and maintaining coalitions and partnerships, analyzing problems and goals, developing strategic and action plans, assessing community needs and resources. We know how important it is to have community assessments to determine what your community needs in terms of resources, specifically in this conversation related to neglect. There's one on developing a framework or model of change. And then there's another one on building leadership. So there's, in addition to these toolkits, just a wealth of information that can support your ability to provide more awareness around issues connected to neglect, and engaging the community and community partners in really being a part of this this effort towards preventing neglect. So I highly recommend that you take a look at the community toolbox. And then we also, Friends has a collaboration toolkit that also provides a lot of good resources and tools to help partner and think about public awareness and ways to connect and engage folks within your community. Again, kind of a step-by-step process that focuses on, and Samantha, I'm not remembering all of the different components, but I see on here hope and mindset are 2 of the pieces that are covered in the toolkit. But we encourage you to go on the website and take a good tour of all the good resources that we have on there that can help you in this work. So the Friends website again has some additional resources that are available to kind of begin having the conversation within communities. So as part of this toolkit, we have a conversation guide, Preventing Child Neglect, Harnessing Community Power Through Conversation. Somebody mentioned, I think, parent cafes earlier. Parent cafes, community cafes, community meetings that bring people together to really begin the process of talking about what we mean by neglect and some of the strategies that can be used to prevent neglect within communities. And so this guide includes discussion starters and strategies for how to bring a group together, questions that can be raised to kind of get the conversation going, who you might want to invite, who you want to include, good resources for engaging community partners. And in this kind of work, you really do want to include your community partners, like your schools, like your community centers and family resource centers, like your faith community. Those folks can be powerful partners in terms of having not only helping you to have the conversation, but perhaps helping to provide resources that can support families to keep them from falling into a situation where neglect is an issue.
So some other resources that are under that same tab that Carolyn was just talking about, the conversation guide. It's the public awareness and engagement tab. Are a couple other graphics, and I know you're going to get a copy of these graphics. Dana's dropping them for you right now, but they're really helpful graphics to think about how you can help prevent child neglect in your community. Now, these are graphics that you can actually take and distribute in your community. You'll see on the very bottom there where it says for more information, contact. You can put your program information on here. You know, if you want to alter it a little bit and put your logo, I'm not your logo, but like if you've got like a website and a phone number or whatever, to try to get more people to be engaged with you around preventing child neglect, and really thinking about this is meant to be used with the general public to provide information on the ways that families can prevent child neglect. Then you customize it to your own organization. But I want to just take a look at a couple of the things that's on here. And this is, again, a resource that you can take and use in your own communities. The first orange kind of house looking thing really talks about their own family. It talks about the protective factors, which we've been talking about. And has information for folks in their own families. And then in the green, it talks about families that you may know. And again, related to the social or to the protective factors, talking about the social connections, supporting families, reaching out to families, having play groups, sharing information. So it's just got some nice steps that you can share. Under purple is for families in your community, talking about having neighborhood meetings, becoming a volunteer. We heard Beth talk about that in her story, volunteering, how important it was to her, writing a letter, whether it's to an editor, or maybe you want to write to, local Congress people, whatever that might be. And then it does have a little bubble up in the cloud about what is neglect, and it's more than a family matter, just to give information to families and community members that may be looking at this. And then it's got a little orange house at the end too about for all families, just helping them understand how neglect can happen, changing the dialogue around it, talking to your legislators about it. So again, this is something that you can distribute and use in the general public, just really to provide that information to families. So that's one resource that you have in the chat. The next one is also another colorful handout, and both these are under the Public Awareness and Engagement tab in the Neglect Toolkit. And this next one is ways that prevention programs can provide support. And so Carolyn, if we could get a look, it's hard to read on the screen, so thank you, Dana, for putting it into the chat. But it's ways your organization can help prevent child neglect in your community, and ways that prevention programs can provide support by developing collaborative relationships to strengthen communities and addressing policy and public awareness. So it's got some really good information, and we heard Carolyn talking a little bit earlier about some of this too, but ways prevention programs can provide support. It lists some things there in supporting families and talking to families about different things, becoming knowledgeable about community resources. Under the handshake is developing collaborative relationships to strengthen communities, some suggestions for that, and then addressing those policy and public awareness things, increasing awareness of board members, engaging parents, writing letters. So again, this is another thing that you can use, and on the bottom, put your program information for people to reach out to you. And these are really meant to get information out into your community, both about your organization and just how communities can be more involved in this. So please use these and take them to meetings, to community events, wherever you think that they may be most helpful to have. So want to take a moment to hear from another one of our parent leaders, and I will pull up another one of our stories from one of our Parent Advisory Council members with Friends. With Eileen, she's one of our, I guess she's been around for a couple years now, but a little bit newer in our Parent Advisory Council than Beth, who you heard from before. But this is Eileen's story that she shared with us, again, up on our Friends website under Sharing the Journey. If you would like to share this with anyone else or watch it again on your own, you can find it on the Friends website. But let's hear from Eileen. If it works. I'm going to try this again because it's not playing for me right now. I'll try one more time. Here we go.
Sharing the Journey, Voices of Parent Leaders, is a resource of the Friends National Center for Community-Based Child Abuse Prevention. Sharing the Journey, Voices of Parent Leaders was created by the Friends National Center Parent Advisory Council to share their lived experiences and expertise on the impact that prevention services, practitioners, and families have together. The story you are about to hear represents an authentic parent experience told in the words and voice of a Friends National Center Parent Advisory Council member.
I want to start off by saying my name is Eileen Graham, and I am no longer a victim, but I am more than a conqueror of child abuse and neglect. My father was murdered 3 months after I was born. As you can imagine, my mom just struggled with that. She was young, married, new baby, and so I'm the oldest of 6. My siblings and I became what they called in New York ward of the court. And so in the midst of that, we suffered. We, meaning my siblings and I. And I can remember times waking them up. We would literally try to open cans of tuna with a butter knife. How we did it, I don't know. So there was a lot of faith, a lot of God's grace. I can remember trying to get them up, get them ready for school. The night before, I would wash their clothes and put the clothes under between the mattress and the box spring so it could look like we ironed them. I just kind of did what I felt I needed to do. I didn't really have much of a childhood because I had to help my mom with the kids. And as a result of some of the things that my mom went through, she started abusing drugs, which turned into her being addicted to crack cocaine. I mean, I can remember being 8 years old, really trying to help her eat and take care of the children she kept having. So I became a teen mom around 16. I had a child in 11th grade. I became desensitized to lies, betrayal, fears, poverty, drinking, secrets, but I started going to see a mental health therapist after my grandmother passed away, and I kind of became the matriarch of the family at like 18 years old. And I didn't really know it then, but as a result of me going to counseling, I decided that I wanted to help build strength in myself. And I believe that no parent is perfect, but we go through what we go through. And our stories of strength and resilience, in my opinion, build hope. And so as a survivor of child abuse and neglect, I really believe that I've come to be a better person. And I want people to know that they're not alone. My lived experiences have shaped who I am. And I've developed a thought that I share with most parents and most families and leaders that work in child abuse and neglect. Change your thoughts, change your life. I am not what I went through. You are not what you went through, and you have the power to not only change your family, but change your communities. And the people around you will help you. You just have to ask for help.
The Friends National Center for Community-Based Child Abuse.
All right, we wanted to share Eileen's powerful story with you to hear from her and from what she felt helped her and how she overcame and is strong today and contributing to her own community. And again, you can watch it up on our Friends website. And as we start to wrap up, we're going to get to, I know we've got some questions here, but first one is share, just because we haven't given you enough resources yet, right? We wanted to give you a couple more. And so Carolyn talked earlier about the collaboration toolkit. This is a website, and you'll get, again, these resources in a follow-up email. One thing that we didn't talk about yet, and I'm going to ask Carolyn to talk about, is the parent and practitioner newsletter. Carolyn?
Okay. This is one of my favorite things to talk about. I am one of the liaisons to our Parent Advisory Council, and they are just a group of fabulous leaders who support Friends and the Friends team in the work that we do. And one of the ways that they provide great support and guidance to us is by putting together about 3 times a year a parent and practitioner newsletter that has information about things that are happening within their states. They sometimes get solicit articles from people in their communities or from federal agencies pertaining to a theme that they have come up with on their own. They write the newsletters. It's available in English and in Spanish, and the link is there. And it's a fabulous resource, and I encourage you to go and take a look at. We have a one that just came out, but there are all the other ones that have been published are available on there as well.
Thank you, Carolyn. Another great resource that you can share with families that you work with. The Sharing the Journey is the website that has all of our voices from our Parent Advisory Committee, including Eileen and Beth's stories that you saw today. And again, this is all up on our Friends website, and it's just under different categories. One thing we haven't mentioned is we have a culturally effective organization framework up on the Friends website. Carolyn and I are working closely with that. And it has 7 different elements to it around having a culturally effective organization, has resources that go along with that. So you are welcome to go check out that framework. Along with, and Carolyn talked about it when she was talking about Kentucky, our Prevention Mindset Institute that we did with 11 or 12 states. We have some podcasts that talk really about what it means to have a prevention mindset and to really tackle prevention within systems. So you can go get more information and listen to those podcasts. And Carolyn also mentioned our free online learning center with a lot of different courses up there that you're welcome to go take at any time on our Friends website. So with that, we have laden you with all these resources. Let's go ahead and get to our last couple of questions. We have a few minutes left. If you have questions, please put them in the question and answer section here. And let's see what we've got. So first one is struggling with how to handle children who are lacking material support, but not because of lack of income, but from allocation of family money to other things like their parents' vices or hobbies. And how do you work with the family on that? So I'm kind of curious if anyone else has dealt with this. You know, if you are working with families and the children aren't getting the support that they need for food, clothing, whatever that might be, because that money is going to other things within the family. And how do you handle that? How do you have that conversation with the family? I know what I've seen with this is in different family resource centers, having parent classes and classes around finances and things like that can be helpful because then the parents hear from other parents. You know, sometimes us going in as a social worker, case manager, whatever that might be, and talking to the parents about how they're spending their money, they may not really listen to that. But when you have that parent to parent interaction around how the money is spent and where it's going to, can be helpful. And I'm not sure if other people or Carolyn or anyone has suggestions when it comes to how to handle when children aren't getting the support they need because that income is going to other things.
Well, I think you mentioned several good ideas. I would just throw in there, parent cafes and mutual support groups, again, where it's more of a peer exchange. Sometimes that kind of support and information is better heard from a peer. So I highly encourage those kinds of approaches as well.
Thank you. Yep, definitely the peer sharing can really help. And you as folks that work with families are the ones that can facilitate that, whether Carolyn mentioned parent cafes, just informal events sometimes, parent education classes, whatever that might be. Um, so you've got a lot of links in the chat, and you're looking at some on the screen right now. You will receive these in a follow-up email, so I don't want you to stress too much about opening a bunch of different windows through the chat. You will receive them all. I know we shared a lot of it. A lot of these, especially the ones that you're looking at right now, you can just find on our Friends website. If you just go to the general Friends website, you don't necessarily have to worry about all these individual ones. The neglect toolkit, the collaboration toolkit, all of that is on the Friends website if you can get yourself there. So, oh, this is great. And just one comment here that they are going to start working with a credit union to help parents for kids' contributions. What a wonderful idea and partnership too. So, and just as a reminder, all of the Friends resources and everything that we shared today is available for free on our website. You can access it at any time. The online courses, our resources, all of that. So we offer that to you. You are welcome to reach out if you have questions or need anything as a follow-up. You always have Carolyn and I know this will eventually be posted up on the Caltrin website as well. Carolyn, any final comments that you want to share?
Well, I just am so appreciative of being invited to be a part of this discussion. And as always, I've learned so many things that you all have shared and things that are working in your community. So I appreciate that, and thank you all for the opportunity.
And I'll just echo Carolyn as well to say thank you. I so appreciate everything that was shared in the chat. Like Carolyn said, we learned from you too. So thank you, Caltrin, for the opportunity. And Carolyn, maybe you want to show that last slide with our contact info. But we appreciate the opportunity. And I think I'll send it back over to Dana to wrap us up.
Thanks, Samantha and Carolyn. We likewise are grateful to all of you who are participants who joined us today, and to Samantha and Carolyn, who did an amazing job of grounding us in what are we talking about in terms of neglect, but also connecting it to the protective factors and some very specific strategies to address neglect, and providing a wealth of resources across the last 2 hours. And I know we did fill your chat today with those. So if there was one or two things you saw in particular that you want to take away, great. But we will, as Samantha has repeated as well, be sending that message in the next 2 days with everything you need to go ahead and explore a little bit more. And we are going to go ahead and go through that chat and pull out some of the resources that you all provided as well. We love seeing local examples. It really brings concrete supports as well as the other protective factors to life, and helps people to understand what is really possible, I think. So again, thank you all for joining us, and we look forward to seeing you in another Caltrin training. Before you go, we have dropped the survey in the chat. At the end of that survey is a certificate if you need or want one. And once you leave the webinar, if you have that survey open, it will remain open. So if you'd like to take some time and leave us some comments, we are planning training for the entire next year right now. This is a great time to tell us what you need in your professional development or in your team's professional development, and to help us guide our schedule. So again, thanks so much, and we will see you soon in another Caltrin training.